Hello everyone, my name is Kayla Peng, and today we will be discussing the hidden cost of sea level rise on global health. Just a brief introduction before we start, my name is Kayla Peng, and I'm a rising junior at the Kempley School in New Jersey. A few things that I'm currently involved in include researching the impacts of sea level rise on the New Jersey Meadowlands, serving on the U.S. Youth Advisory Council for the UN Ocean Decade, and leading my school's print publication Ballast, Environmental Club, and Math Club. I am also the founder of EcoEDU, an organization that aims to expand climate change education in grades K to 8. I'm interested in environmental engineering, and I hope to be working in this field in the future. So just a little bit more about my credentials on the topic of sea level rise impacts on global health. On the leftmost column, you can see what I worked on my freshman year, which includes conducting a green bonds feasibility study and being able to publish that in a journal. Moving on to the next area, you can see that during sophomore year, I was interested in investigating the impacts of sea level rise living in a coastal state myself, which led me to connect with the Meadowlands Research and Restoration Institute and allowed me to explore the socioeconomic impacts of sea level rise in the Meadowlands. I was also able to extend this project this summer with the Open Bio Student Research Institute program. And concurrently, I am working on ChatGPT 4.0 applications in the environmental field under a professor at Rutgers. And so this middle column really piqued my interest in sea level rise, and I'm really excited to talk about what I've learned doing this research today. According to the World Health Organization, climate change is the greatest threat to global health in the 21st century. Climate change is undeniably a global health issue, but its effects are slow and not as immediate as what we usually associate with global health, like viruses like COVID-19, and manifest in many ways, and especially in the increased frequency and intensity of natural disasters. 90% of natural disasters within the United States involve flooding. Consequently, floods inflict the most economic damage and loss of life than any other natural hazard. And that's just going to worsen in the coming years, not only because of increased frequency of natural disasters, but also sea level rise, pushing flood boundaries inland. Flooding also stands out from other types of disasters because oftentimes it's possible to prevent flooding by taking measures such as building resilient infrastructure or restoring wetlands. The more we delay, the more we pay. If you look at the picture on the right, you can see that even when homes are dry, they can be isolated long before they are inundated. In the Florida Keys, a 2-foot rise in sea level will inundate about 22% of the population, but isolate 44% of it. This causes a significant loss of real estate value because the property is cut off from surrounding infrastructure. And when a property or the infrastructure that surrounds it floods too frequently, the market treats it as effectively inundated, leading to a drastic fall in value. And even properties on high ground could be devalued if they are served by a main road or infrastructure that floods often. And on the left, you can see an infographic saying that 17 coastal states have lost nearly $16 billion from 2005 to 2017. And you can imagine how much worse it's going to get with sea level rise coming more and more into the equation in the next few decades. And obviously, there are severe global health consequences to this isolation and inundation. For those needing urgent care, they will simply not be able to access it when flooding occurs. This affects the elderly population especially, which is bad because more seniors are living in coastal communities now than ever. People will also be cut off from grocery stores, schools, hospitals, fire stations, etc. And these locations are essential for the well-being of communities. Of course, there are direct impacts of flooding, like injuries, hypothermia, lung disease from wet areas creating mold, and undernutrition from not being able to access locations like grocery stores. Floods can also cause your drinking water to be contaminated because floodwater can infiltrate your underground source of water. This water can have harmful bacteria and particles like E. coli or fertilizer that can cause issues like diarrhea, vomiting, and stomach pain. Significant increases in depression, anxiety, and psychological distress among flooded adults were detected after a flood occurred. And studies also showed that increases in PTSD following flooding occurred also. So this has severe mental well-being consequences. And this kind of also emphasizes the difference between primary stressors and secondary stressors. Primary stressors are the direct outcomes of the flooding event, but secondary stressors are the lengthy recovery period afterwards, which can severely impact people's mental health as they worry about reoccurrence of this flood event and how to rebuild after disasters. There are also many challenges to people, families, and communities returning to normality that can lead to increased anxious, depressive disorders mentioned before. Black and Hispanic communities face a disproportionate risk of isolation, especially at sea level rise of 4 feet or greater. Older adults also constantly face higher risk of isolation. These graphs point to significant inequity in the burdens associated to sea level rise. Sea level rise is a massive issue that affects many people, but if we implement preventative solutions and take action now, we can lessen its impacts. Government policies are extremely effective. We need to formulate policies that prioritize flood management and allocate necessary resources for at-risk communities. Effective communication can also save lives. By installing early warning systems using weather forecasting and satellite data, we can alert residents about floods as soon as possible. We also have to make sure people without access to the internet and the homeless are also able to receive this information and evacuate as soon as possible. And I think one of the most effective ways to protect against floods is to improve our existing infrastructure. We need to construct infrastructure that can withstand flooding and start using flood-proof building materials. Enhancing drainage systems to efficiently divert floodwaters away from populated areas is also a great way to utilize infrastructure to reduce the impact of floods. We can also restore natural wetlands to act as natural buffers against floodwaters. And I think most importantly of all, it's up to us to speak up in our communities and advocate for these changes to be implemented. And these are my references. And I would like to thank Dr. Peckman from the Meadowlands Research and Restoration Institute and my mentor, Sam Portillo from the Harvard College Open Bio Student Research Institute program. And I would like to thank the U.S. Youth Advisory Council from the UN Ocean Decade for equipping me with advocacy skills needed to make a difference, and the staff at Global Health Leadership Conference at Johns Hopkins University for giving me this opportunity to speak. Thank you so much for listening to my presentation, and I do hope that you enjoyed it. And here are my credentials if you have any questions or want to reach out. And some key takeaways are also on this slide too. Thank you so much, and I hope you have a great day.